There are lots of diseases like endometriosis that have very similar symptoms, which can make it difficult to find a diagnosis. And patients tell us that they can find it hard to explain their symptoms. Tracking your symptoms over time can really help your doctor to understand how you're affected by them and when. But how do you decide which symptoms to track? Meet Estr. Estr was developed by Endometriosis Cymru with funding and support from NHS Wales, Welsh Government and the Medical Research Council to help patients with symptoms of endometriosis and their doctors. Other symptom trackers ask about every possible symptom of endometriosis, but Estr is different. Estr focuses on just 5 symptoms that can help to focus your discussions with your doctor. Pelvic pain, bowel pain, upper leg pain, urinary pain, and deep pain during or after penetrative sex. Using Estr is easy. Just sign up for a free account at estr.cymru and follow the instructions. Estr can be used in English or Welsh and doesn't have any hidden costs. We do store and use some data from Estr to help us understand more about how these symptoms affect people and also to help us improve the tool. But this data is always completely anonymous. When you log in, you'll see it's made up of 4 sections. The About You section asks some background questions and builds a picture of your medical and care history. Completing this will take a few minutes, but you only need to complete it once. The symptom record is where you record what bleeding or symptoms you've experienced over the past 24 hours. We'll ask you to rate the pain intensity, how much it hurt, and impact, how much it affected your day. The symptom record takes less than a minute to complete, and you should try to complete this every day, even if you're not experiencing symptoms. Remember, the pattern of your symptoms is useful information which can help your doctor to understand how your symptoms change over time. The treatment and care record is where you log any changes to medications, tests, or diagnoses you've received. You only need to use this if something changes. The report section is where you can see all your information displayed in a way that's easy to share with your doctor. It includes your relevant medical history, along with your symptom records plotted on graphs. We recommend using Estr for at least 2 months before sharing your report with your doctor. When you do see your doctor, having all this information to hand can help you feel more confident discussing your symptoms. To find out more, visit estr.cymru. It's important to remember that if you've been asked to use Estr, it doesn't mean you have endometriosis, and don't forget, if you're worried about your period or menstrual health, always speak to your doctor.